The information presented in this program is for educational purposes only. It is not intended to diagnose, treat, or cure any condition, illness, or disease. The depiction of successful results from the treatments discussed in this presentation are examples of the possible benefits and do not guarantee results. The decision to start any medical treatment should be made only after discussing all benefits and risks with a healthcare provider.
Welcome to Healthy Dose with Dr. Joe. Are you ready to repair damage to your body? Replace what is depleting to regain your youthful vitality? Regenerate what is now degenerating? Dr. Joseph Gambardella is a doctor of chiropractic medicine and an anti-aging health practitioner diplomat. He was the first doctor in Miami to complete his fellowship training in stem cell therapies. As the owner of Advanced Physical Medicine and Rehab of Miami, he provides patients with the most sophisticated and safest treatments in the market today. Join Dr. Joe for the next half hour and learn about the medical advancements that have helped thousands avoid surgery and pain meds. From stem cells to hormones and everything in between. Get ready to feel empowered. Get ready to regain control and reclaim your life. Now, here's your Healthy Dose with Dr. Joe.
And we're back with another episode of Healthy Dose Podcast. I'm here tonight with Robert Jr., also known as Rob Ashenoff, from the reality TV show South Beach Tow. How you doing, Rob?
Good, brother. Good. Here.
Yeah, man, this is going to be easy hat for you. You're used to TV. How you doing with radio?
It's just another day of walking a park.
I'm Dr. Joe Gambardella with Advanced Physical Medicine and Rehab of Miami. You can check us out at APMRmiami.com and also visit our website, MiamiDiscCenter.com. Rob's with us today for that reason. We're going to talk about his recovery here in our office. We're going to talk about how he got in trouble to begin with. When we see Rob, he's very impressive. He's about, how tall are you, Rob?
6'7".
6'7", every bit of 6'7".
345 pounds.
Yeah, we're glad he's on our side. But he's a big teddy bear. But you came to see us, Rob, how long ago was it?
It was in September.
We were just talking before the show how we're at the
September, yeah.
We're at the end of 2019 and time is flying by.
Yeah.
When we're having fun, but you weren't having fun in the beginning.
No, man, no.
So how'd you come to see us, by the way? How'd you find out about our office?
It was social media, actually, man. The wife pointed it out to me, and she's like, yo, you need to really go check this out. Like, you're in all this pain. Like, why don't you do something about it? You know, obviously it's not going away.
Well, you got the stereotype of being big, tall, strong, good looking, all those things.
Oh, damn.
And
I like the whole good looking thing.
But, when we're big and strong, you don't want to admit that you have a problem. But
yeah, no, that's true, man, because it makes you feel weak. So, sometimes you just got to put your pride away and just run with it,
And we're going to talk later on in the podcast about all the charity work that you do. But you mentioned to me, I remember when we first got in there for the initial consult, you were coaching. Was it at Miami High?
Miami Jackson.
And you love doing it.
Did it for 5 years, man, and probably about the best 5 years of my life, man. I had some really good girls come and go.
Yep. And when you love doing something, you can't do it anymore.
Oh, dude, it kills you, man. It just destroys you, man, because you're so used to doing like a natural thing that comes to you. You know what I mean? Especially working with kids and everything else. And it was something. It's not because you didn't want to do it anymore. You just could. This was a back injury. So you had a really bad back injury. Tell everyone how that started. Oh man. Chronically, man, like just years of abuse, man. And I work with these kids, and I actually practice with them too. So the jumping around and everything didn't quite help it out.
Yeah.
Diving on the floor, you're 6'7", 345, almost 40. It's hitting that floor ain't the same anymore. Yeah. So yeah.
And so it was a little bit at a time, or was there one particular move or episode that really triggered you? And
well, that I was working out with the girls one day, and I felt that tension. That was a few months before the big injury, and you felt the tightness. You know what I mean? You'd walk, and you just felt weird. You know what I mean? But you just kept on going. It's like just walk it off. It's a man thing, I guess. You slice your arm off. Oh, don't worry, it'll stop bleeding. Right. But yeah, and a couple months down the line, here I am cutting the yard, and just out of the blue, man, just pop, and you're like, and now you can't move. It's like, no.
And until you have 10 out of 10 pain, nobody could really understand that.
Yeah, dude. And I'm pretty good with pain, man. And yeah, this was a pain that literally put me in tears. Like
so 10 out of 10 pain. You stopped cutting the yard. You know, you came to see us. You had some diagnostic work done on the lower back. You had an MRI done. How recently was that MRI done?
That was done when I woke up one day and I was just in so much pain I couldn't move, and I let it lag off through the day, and you know, everybody came home and I just couldn't tolerate it no more. And
yeah, so that was, I actually have the date. It was 8/24 of 19. You came to see us.
There you go.
September 10th, 2019. So traditional care. You went to the hospital.
Yeah, went to the hospital. They saw that I couldn't move. First thing, of course, is, you know, pain meds and, you know, throw them under the x-ray and see what's going on. And then they hit me with the news, you know, the multiple herniations. And, yeah, it was just...
And the pain meds didn't do the trick. I mean,
pain meds did nothing, absolutely nothing. It was like a temporary... It let me sleep for about 2 hours, and that's about it.
Yep. And were you trying, you know, the end of August into early September, were you trying to work through it?
I really was. I tried my hardest.
Yeah.
And then just the fact that I couldn't even, like, hardly walk was...
You know, it's interesting because I do remember the day you came in to see us. We were trying to do the consult and you couldn't even sit. You said, you don't mind if I just stand up in the office? And we tried to get through it as quickly as we can. But we took the x-rays. It was a heck of a time for us to get the results of the MRI in. But all roads were pointing toward the disc. We took the x-ray. We easily could see that there was a misalignment in the lower back. And with the symptoms that you were having, a lot of people don't know that disc injuries, you know, dependent upon your age, it's when is it going to happen, not if it's going to happen.
Yeah, that's a fact right there.
So you're still on the young side, Rob. You're what?
40s.
So in your 40s, I'm going to give you some statistics. There's there's 5 injuries to the disc that are very, very common, and in your 40s, almost 75% of the people already have some degeneration to their disc, meaning that it's been damaged to the point that it can't fully heal by itself anymore.
Well, the way I used my body like an amusement park when I was younger, I can see that.
And, you know, if someone said, hey, you have a 50-50 chance of winning, you know, with gambling, you'd say, I'll take it every time. Mm-hmm. But, you know, in your 40s, there's over 50% of the people have some sort of an early stage herniation already. About 25% of the people have a full-blown herniation where there could be symptomatic or where there's a tear. And even in your 40s, about 20% of the people have arthritis that's present and set in already.
Yeah.
Those are the interesting thing about the stats that I just gave you. That's the percentage of abnormal findings that we see on MRIs and CTs in healthy pain-free subjects.
That's crazy.
So you already are built in with a predisposition, not just you, but everybody, to have these injuries, and it's just the right move or the wrong move at the wrong time, and it sets you off.
Yeah.
So your MRI came back, and what it said was that there was loss of the disc height. And that when we're looking at discs, the disc is a tricky area of the body because when these discs tear, the fluid that escapes is called the nucleus pulposus. It's actually it's water.
Yeah.
And when that disc tears on the back side and that water escapes, the only place it's going to hit is a nerve.
The nerves.
Right. And what your MRI said, there was a loss of disc height. So if there's a loss of disc height, chances are there's going to be a tear in the disc and the fluid is going to escape. And that's exactly what your MRI showed, was that you had a right paracentral disc osteophyte complex at L5S1. The most interesting thing about the terminology they used was it said it mildly puts pressure on the descending S1 nerve.
There was no mild about it.
Right? Yeah. And, you know, when we're looking at MRIs and CT scans, you want to see the word normal. You want to see the word or the words like we have here, no canal stenosis, no foraminal narrowing. Anytime you see no or normal, that's a great thing. Yeah. Abnormal, complex, you know, disc complexes on MRIs, like you said, there's no such thing as a little bit of pressure on the
No. Not even Dilaudid help. So yeah, there was definitely a lot of pain.
Yeah, so there's a couple of options when you're in a situation like that. You got 3 options. You got number 1, medicate it, right? Number 2 is cut it, because at some point in time you may have even crossed your mind that maybe this is going to be something surgical. I'm in so much pain.
That was my biggest thing. You know, that was my biggest fear, and I was like, you know, and I saw all the reviews for here. You know what I mean? And
yep.
I was like, man, let me just go run with this and see what happens, like.
Yeah, and the other option is to decompress it, actually pull the pressure off that nerve. If we're talking about giving an example, think about a jelly donut, think about a sunny side up egg. When you compress that, the egg pops.
Yeah.
You squeeze the jelly donut, bite into it, and the fluid leaks out. That's exactly what you had.
Yeah.
So you were in a delicate situation. You were in a lot of pain, and we do want to decompress and pull the pressure off that nerve, but you weren't even a candidate for that when we started out.
No.
We could hardly get you up onto the table. So why don't
It was hard.
Why don't we touch on some of the things that we did to get you back to working full time, feeling great, being like yourself, and I'd say as of today, December 10th, or what is it today? December 9th, December 10th.
Yeah.
What percentage of improvement would you say you've had from the time when it was at its worst?
It's a complete 180, man. Like, I didn't think it was gonna be this level already. You know what I mean? Like,
you know what? As we're speaking, I'm remembering too. One of the things that we wanted to do was give you an injection. We spoke about on previous shows and previous podcasts, Prolozone.
Yes.
Those treatments.
Well, we had to wait on it, but yeah.
Even why do we have to wait?
I had a very bad reaction to pain meds.
Yeah,
I
a
had
rash all over your body.
Yep,
yeah, all over the front and back of your body. And Christina, our physician assistant, amazing physician, she wouldn't even touch you.
Yeah,
wouldn't touch me. She gave you the instructions right then. Stop taking it. And when you're in a situation where you're in a lot of pain, we had better be able to deliver something to help get you out of pain. So we started out with, if you remember, some laser therapy.
Yeah, laser therapy, the shock wave.
Yep.
Tesla.
Yep. So let's touch on that. Everyone's got to know, and when we explain to our patients, Rob, and even to you, is that stem cells are very important in getting the body to heal. They're all over the body. They're always working. That's how our body regenerates and heals. But oxygen is just as important. So you have stem cells in and around your lower back, in and around the disc, but they're inactive. Stem cells in muscles are always active. Why? Because they're exposed to lots of oxygen.
Yeah.
That's what blood, one of the many functions of blood is to detox, but also to deliver nutrients, including oxygen to muscles and tissues that have been damaged. When you start to get closer to a joint, you run into tendons. Tendons have stem cells in and around them, but less oxygen.
Gotcha.
So you start to see more commonly tendonitis, tendinopathy, ligament sprains, things that take longer to heal. Once you get into the joint, like the lower back, you have stem cells around the lower back, but there's no oxygen present.
Yeah.
So the stem cells are inactive. Your body can't use those stem cells to help the disc heal, to reduce inflammation. So the problem gets progressive and it becomes degenerative, meaning it will get worse with time. So our reverse engineering is we got to get some circulation into this tissue.
Yeah.
So we use shockwave, which is a very strong sound wave. We use laser therapy, which softens blood vessels, makes them more expansile, to pump some oxygen in and around the lower back. And slowly,
the heat,
right, your inflammation started to decrease, and you found that you could move a little bit more freely.
Yeah. The first couple weeks was.
And you were
touch and go.
You were with a cane.
Yeah, I was with a cane. Sometimes I had to walk a lot.
Yep.
I was wheelchair.
And sometimes, you came in twice a day. We would do these sessions, these laser sessions. The Tesla Max is a form of electrical.
Yeah, you couldn't even touch my back to crack me or nothing because.
And that's so important that, you can't force a technique on a patient. You have to get rid of the inflammation, control the inflammation first to be able to do some of these therapies that are going to change the overall outcome in the long run. So we just took it easy.
Yeah. And, like I said, I had my doubts, man. That first couple of weeks was a touch and go with me, man, because, at any moment I was getting ready to just be like, yo, I give up, dude. I can't.
Yep. And it's kind of like the Navy SEAL mentality is you never know what the next step brings.
Yeah.
And then one day, you know what? The inflammation started to go away. The rash started to go away. We were able to get you back there to see Christina. She gave you your first Prolozone injection.
Yeah, felt like I had a butt implant. But
Yep.
Yeah.
And again, more oxygen.
I swear, it was the weirdest thing. Like, you walk and it just jiggled and you're like, it was the weirdest thing in the world, but it felt good. You know what I mean? It was like, okay, I could deal with this, but the whole jiggle, you know what I mean? It's
that
like,
slushy sensation. Yeah. And Prolozone was so effective because, again, that puts oxygen in and around the joint, activates your stem cells. So with the laser therapy, the Tesla Max, and really for the first time with the Prolozone, your own stem cells started to do their job.
Yeah.
They started releasing growth factors, and these growth factors.
Literally right after I got that first injection, like within that week, I got off the cane.
Yep.
Like it started helping me heal that quickly. like you felt the pressure start going away. It just felt really, really different. It felt like more calming, you know what I mean? Like certain things, you movements would set it off, but it wasn't like a prolonged set off, you know what I mean?
Yes.
It just, it was a quick, oh, don't do that,
Yep,
you
yep.
know?
And then, in addition to, we found out that you had severe weakness of the glute muscles, the muscles that stabilize the pelvis, the glute medius, glute minimus, the piriformis, the quads and hamstrings had to be reset, the lumbar erectors, and that was uncomfortable, but we did some vibration therapy and slowly worked our way through that to the point that we could first adjust you.
The Indian stick, yeah, man.
Yeah, yeah. And, you mentioned you had actually had some chiropractic work done in the past, right? You had some chiropractors?
Yeah.
So this can happen, just like if you take nutrients and supplements, you can get a cold, but you get over it quickly. But the fact that maybe you had some care, in the past enabled you to get through this non-surgically.
Yeah, I mean, maybe, you know what I mean? Like I said, I had never experienced pain in that level.
Yep.
And I mean, I've been stabbed, I've been shot. Like I've never had pain like that.
Yep.
Like it was just crazy pain.
and the most important takeaway is that there's, for every problem there's a solution. There's the right solution, and this one for you was the right solution. It took time for that disc injury to occur, for that disc to tear, for the nucleus to leak out and hit the nerve, and it's taken time to go back in. The best part about what we're doing is it's drug free.
Yeah.
It's non-surgical, and your body is healing by itself.
Yeah. No, it's definitely.
For
me to be able to start touching my toes again, you know what I mean? I'm a very limber guy. Like I said, I'm always active. My weight is just because of poor eating. You know what I mean?
Yep.
And stress.
Yep.
But the fact that when I played sports and still play sports, I still can touch my toes, and to not even be able to bend down or even pick my leg up, you know what I mean? It destroyed me, dude. Like, dude, I got everything from. The depression started to set in because you can't, you're like helpless, you know what I mean? And then the frustration and the anxiety starts popping in. You start popping off on everybody, you know what I mean? It's just it got to that point, you know what I mean? Like if I didn't come here, there was it was gonna probably lead to surgery or just God only knows.
Yeah, and go check Rob out on his show South Beach Toe. Check out some of the clips on YouTube because
there's clips on YouTube.
Yeah, when you almost look like you're impenetrable. People see you, you can never be hurt, and listen, it happens to everybody. Younger, older, bigger, shorter. Disc injuries are going to happen.
Well, here, funny fact on the show, and if you ever watch it, there's a clip on YouTube where I'm going against a guy from a nail salon, and he does like some karate stuff or whatever. I actually filmed that with a torn meniscus, and never hurt as bad as that back did. I was walking on the meniscus and everything. I had it wrapped up. If you ever look at the pant, you'll see like this big ass bulge. It's from the wrapping inside the pant leg.
Yeah. And
I filmed all that. Like for 3 days, I filmed with a torn meniscus, and it didn't even hurt nearly as bad as this back thing. So that just tells you like the level of pain that I was in. Like I couldn't do nothing.
And like we said, the best part was you were starting to get better. You were starting to get back to work, and you went to work regardless. And we were seeing you twice a day. We were coming in on weekends to see you.
I'm one of those diehards, bro. I can't miss work.
You never missed work.
Never missed work. Well, I did end up missing like 2-3 days, but yeah.
But in the grand scheme of things, you were starting to get better, and then you came in one day and the cane was back. And we said, what happened? I mean, things were looking up. You were healing.
And she don't know about it. But I got clipped by a car one night that I was working on the side of the highway. Clipped me, spun me around. Kind of set me back just a little bit. They went hard on the therapy, got me, right back. It was like a day 2 tenderness, and
and we bounced back. But that's whenever you see somebody on the side of the road with a
She's
tow
looking
truck
at me
with
saying
lights
she's
on,
gonna kill
you get a lane. Yeah, you get a lane or two over because it's guys like you, Rob,
man,
all the people out there that are helping people.
Yeah, man, they're like, nobody respects that slow down, move over law, and they don't understand how important it is.
Yeah.
This year alone, we've lost almost 63 different tow guys throughout the United States. Which, I mean, if you look at it statistically, it's kind of whatever. But you also got officers. We've lost a lot of officers.
Yeah.
You know what I mean? I've had some very close friends that are FHP and stuff like that, you know, standing there trying to help somebody change a tire. Boom. You know, and now, you know, 2-3 kids ain't got no daddy. You know what I mean? It's crazy, you know, and people got to understand that we got families to go home to. You know what I mean? Yeah, we might be, in your eyes, the big scumbag, but, you know, we're helping people out.
You're doing what you're doing your job. Everybody's got to do their job, and you know we got to stay healthy. When we come back after the break, we're going to talk about what we did to get you healthy after that setback, how we got that disc to heal, and get you back on your toes. And we'll do that right after this break.
Repair your body. Replace your key hormone levels. Allow your body to regenerate itself without surgery or meds. When it comes to your health, the best plan is preventative. If you wait for symptoms to show, you could be too late. With over 40 years of combined clinical experience, all under one conveniently located state-of-the-art facility, Dr. Joe is on the leading edge of regenerative and physical medicine. Take control of your health and get a free consultation and evaluation. Visit us at apmrmiami.com or call 305-598-8788. 305-598-8788. 305-598-8788.
And we're back with Robert Jr. from the reality hit TV show South Beach Tow. Great friend of the practice. He's like family now. Robert, we were talking right before the break about this setback that you had with your lower back. You were helping somebody out on the side of the road. You got spun around, flared up the back a little bit.
Flared it up big time, yeah.
And we got you, you know, same protocol. We got you back on some therapies, got some oxygen, using some of the electric stimulation, the very specific type of electric stimulation to get some deep muscular contraction. Use some low-level laser therapy and some high-power laser therapy.
The high-power laser, yeah. That actually put me back on track pretty quick.
Yep.
And
so, you know, reduce the inflammation. The reason that works so well is because, as we mentioned earlier, Prolozone, laser therapy, Tesla Max, the whole idea is to get some oxygen in and around the area where you have damaged tissue, activate your stem cells. Oxygen activates stem cells. And then once your stem cells are active, your body starts to heal again.
Yeah.
And, you know, you started to feel better. We finally were able to get you up on some decompression just within the last couple of weeks.
Yep.
And
we're getting to the last stages.
Yeah. So what do you tell your friends that, you know, that have back pain and they say, you know what?
I swear by this place now.
Yeah.
I mean, you know, everybody's watched, you know what I mean? And I didn't post for a while on social media, just, you know, because of the depression and trying to keep my head clear, you know what I mean? Because I hate the thing, oh, Rob, you know, if there's anything I can do. Yeah, I don't want the sympathy, dude. You know what I mean? I just want to get better. And, you know, it took a lot out of me, dude. Yep. And now everybody's starting to see. They're like, yo, you're
Rob's
a totally
back.
Different guy. Yeah, bro. Thank God. You know, like.
Yeah. Yeah. Bigger and better than before. But, you know, some of the key takeaways are when you're walking around the mall and you see people in canes and walkers, and they didn't start out that way.
Yeah.
And there's warning signs. And just like, you know, you're circulating, you know, this guy, I'm going to have to move this guy. There's things that we look for. And when you're having trouble tying your shoes, when you're coughing and having pain, when you're taking pain meds throughout the week, even once or twice a week, that's when it's important to get treated. You know, you brought the missus into the office today.
Yeah.
And she's having some issues, but she's feeling pretty good. That's the best time to treat.
Yeah.
It's the absolute best time to treat. On the last show that we spoke about, you know, people, you know, they're aware of the dangers of anti-inflammatories and, you know, taking these non-steroidals and, you know, ibuprofen.
Yeah, man, stay away from the
right?
pain meds, man. Like I said, that's like a demise of people, man. Because it is so easy nowadays just to get hooked on, you know, that oh, I'm feeling so good, you know what I mean? And you can never match. You're like, okay, there's an old saying, you can never match the same high as the first time. You know what I mean?
Yeah.
And that's the same way with pain meds, you know what I mean? Like you'll feel great like the first week, but then your body immunes to that stuff really quick.
And you know, you're easily addicted. Mm-hmm. And the worst part about it doesn't do anything to fix the problem.
It does nothing.
It's just treating the symptoms. You know, anti-inflammatory is the same thing. And you know, people are starting to gravitate toward the acetaminophen or the Tylenols because they think it's a safer alternative.
Yeah.
And we spoke about over 50% of the acute liver failures in the United States are due to acetaminophen.
There you go.
You know, not hepatitis, not inoculations where people get smallpox, or where there's stress on the kidneys or hepatitis, it's from overuse of acetaminophen.
That's crazy.
And people think it's safe.
Yeah.
So
I thought ibuprofen was safe.
yeah, with one of the great parts of also being part of Disc Centers of America is that all of the work that we do to treat these injuries, it's based on medical research. Dr. Norman Shealy out of Harvard University set the protocols on how to treat disc herniations, disc degeneration, facet arthrosis, bulges, prolapses. And, not to see is to guess, to see is to know. We never guess when it comes to somebody's health here at APMR Miami and Disc Centers of America. You need the diagnostics.
Yeah, no, you definitely need it, man.
Because for each disc injury that you have, there's a certain amount of weight that you have to use to pull it. There's a certain angle of pull that we use. And predictably, when you do these things the right way, Shealy's results came out that 88 to 92% of the people have successful outcomes.
That's a great number.
And, if those were gambling numbers, we'd all be rich. But
yeah,
you know what? The best gift that we can give somebody is the gift of health. So now that you're feeling back to yourself, one of the things that I love about you, Rob, is when we first met, you said you just wanted to get back to your girls and doing things. You're so philanthropic. I think people need to know all the great things that you do. Tell everyone what you did over Thanksgiving.
Oh, we gave out 3,700 turkeys in 2 days.
3,700 turkeys.
Yeah, we did the Rodriguez charities, the PAO, just different networks that I work with, just giving out,
Yeah.
people. The PAO did the full meals. The Rodriguez charities was just really, really big ass turkeys.
Yeah.
Sorry to say, I don't know if I'm allowed to cuss or
Yeah,
not, but yeah.
Hey. That's you.
They were big turkeys, dude. I was like, yo, I need one of those.
But you're always doing something philanthropic.
Always, man.
You're always giving back.
I work with the Broward Children's Center. These are kids that are abused. These are kids that have just been through traumatic things in their lives, and it's nice to bring a smile to their faces. You know what I mean?
Yeah. When people check you out, Rob, you have a huge following on Instagram. How do they find you?
Rob Ashenoff Jr. or South Beach Toe Rob Jr. And that's how you find me on all my social medias. I keep it pretty easy.
But people, you post up some really great things about the charitable work that you're doing. People could, everyone after seeing the show and after meeting you in person, you're endeared to a lot of people.
We're getting ready to do the Toys for Tots.
Yep.
With the Miami Beach Police Department and Police Athletic League. I'm getting ready to start with that, and I'm also going to do another one because I'm trying to get it organized with the abused kids' homes. I'm trying to get bikes together. I'm going to just build a bunch of bikes and just, here you guys go, working bikes, what I mean, for free. And I get the bikes from different organizations that, like usually police departments and stuff like that. People don't claim the bikes and, they get rid of stuff, you know what I mean? And just get a bunch of pieces of bikes and just start putting.
You know what? You're a healer at heart. It's to say you love helping people. It makes you feel better. That's kind of why we do what we do too.
Yeah,
it's the best. The best part about just our talk tonight is just hearing you sound like yourself again. And
man, it feels great to be back, dude.
Yeah.
Now as soon as I can start working out, man, I'm right back on that horse, man.
Yeah. So when you have these issues, whether it's your back, your knee, your hips, and you feel something's not right, it's a warning sign. Do something about it. Get it checked. It's going to save you time. It's going to save you money.
Oh, yeah.
Most of all, it's going to save you from surgery and drugs.
Don't wait till the last minute.
Don't wait.
I did, dude.
Don't wait. Don't wait.
It was a close call.
So check out our website, miamidisccenter.com. You can always follow us here in the office by visiting our website, also apmrmiami.com. Check us out on Instagram at apmrmiami. Rob, they're going to check you out on Instagram at Robert Jr.
Yeah, Robert Jr., Rob Ashenoff Jr., South Beach Toe Rob Jr. It's all the same.
Yeah, check out our YouTube channel below. And we're going to be back the beginning of the year. Rob, we're going to have you on once you complete your therapy, hear a little bit more about the great things that you're doing. But I want to thank you for coming on tonight, and I'm so happy to see you doing great, brother.
Thank you, Doc.
All right.
It's a pleasure.
All right, we're going to be back next time. APMRmiami.com. Check us out at APMRmiami.com. Remember, repair, replace, regenerate. We haven't said that in a while, but the best medicine is prevention. So we're going to catch you next time with more information about
That's actually pretty
keeping
damn
your lower
catchy.
back healthy. And we're gonna key you in on some secrets to lose weight even before the new year.
Yeah, don't be a fat guy like me.
All right, we'll see you next time.
Yeah, I'll be good.